Hi, I'm Adrian Nuñez from University of Northern Philippines College of Nursing, and I'm here to demonstrate on the two procedures of surgical hand washing and the open gloving. Before we proceed to the procedures, make sure to remove all accessories in our hands. The ring may tear gloves and may harbor microorganisms. In the surgical hand washing, first, wet hands and arms under running lukewarm water. Lather with soap or detergent to 5 cm above the elbows. The water flows from fingertips to elbows. Tips are considered to be cleaner than the elbows. Use firm circular movements to wash palms, back of hands, wrist, forearms, and interdigital spaces for 20 to 25 seconds. Next, clean undernails of both hands with nail pick or nail brush. This is to remove dirt and microorganisms. After using, discard it to the bin. Rinse hands and forearms. Once hands and arms have been washed, use the sterile surgical sponge. You need to moisten the sponge under running water by squeezing and releasing it. With fingertips together, use a light but firm pressure. This will take for about approximately 30 times. Next, we're going to flip the sponge to the non-abrasive side. Place fingers side by side and scrub the surface of the palm 10 strokes. After that, turn the hand over and scrub the dorsal surface for another 10 strokes. Next, scrub the outside surface of the thumb from wrist to tip of the thumb 10 strokes. Continue to apply 10 strokes to the other side of the thumb and to each side of your fingers. Once you scrub the area, do not go back. Now that you've scrubbed your hand, it's time to scrub your arm on the same side. Mentally divide the forearm into thirds from wrist up to 2 inches above the elbow. Apply 10 strokes from top to bottom. Repeat the scrub on the other hand and arm. Discard the sponge after using it. Start rinsing at your fingertips and continue to the hand, forearm, and elbow, moving in one forward direction through the water. Always keep your elbow at a right angle and raise above the level of your elbow. Do not move arms back and forth in the water. So, now we have finished surgical hand washing. It's now for us to proceed to the open gloving. We're going to perform the surgical open gloving, and before we proceed to the open gloving, we shall see the size of the gloves, and also it will not repeat the usage of the gloves, and also check for the expiration date. Check that the sterile glove package is dry and unopened. Sterile gloves might already been opened and contaminated. Checking expiration date is still valid ensures sterility of the gloves. Open the outside wrapper by carefully peeling the top layer back. Remove inner package, handling only the outside of it. And this will maintain the sterility of the gloves. Next, place the inner package on the work surface with the side labeled cup end closest to the body. Carefully open the inner package. Be careful not to touch the inner surface of the package or the gloves. Determine which the dominant hand and the non-dominant hand. So let's use our non-dominant hand in grasping on this side. Insert your dominant hand, while your non-dominant hand is assisting in the insertion. making sure that the unsterile hands touches only the inside of the gloves, keeping the outside sterile. Going to put our dominant hand to the inside part and make sure that the thumb is abducted. Place the fingers of the glove hand inside the folded cup of the other glove, taking care not to touch anything and observe sterile technique. Carefully insert the non-dominant hand into glove. Now we're going to arrange our gloves. Adjust gloves on both hands if necessary. Interlock fingers of glove hands and hold away from body above waist level until beginning procedure. In removing soiled gloves, use dominant hand to grasp the opposite glove near cup. This is to prevent contaminating the hand when removing glove. Hold the removed glove in the remaining glove hand. Next, slide fingers of ungloved hands between the remaining glove and the wrist. Take care to avoid touching the outside surface of the glove. Remove it by pulling it off. Discard the gloves in appropriate waste container, and after that, perform hand hygiene. Now we're all done with the two procedures and our return demonstration on the surgical hand washing and the open gloving. Thank you for watching.